It's Daddy. I can't be brief on this. If you've not scrolled up yet, give me a chance to explain the importance of fucking insurance, health insurance, in relation to subsidies in the marketplace. I'm sure there are plenty of videos. This is my experience. It may not be your experience, but I'm going to try to provide some semblance of a real life scenario that applies to me and may apply to you, or may not apply to you, but it may apply to somebody that you know. Let's assume that you don't have insurance through your employer. Let's assume that you aren't eligible for the state-sponsored insurance, i.e. Medicaid. And let's assume that you don't make your W-2 earnings are not high. Let's say you're above the poverty line, but you're right at the paycheck to paycheck line, and you don't have any sort of real savings to cover a catastrophic event. And let's say that you have limited credit availability, and let's assume that you're not a young person. I just called the healthcare marketplace and I got a licensed healthcare agent. When I hear that, that means somebody's working on commission. He talked too fast, he talked on top of me, and he's US based. So that means he's selling me something. Now, in years before, if you had a question about the Affordable Care Act, you would get someone and they wouldn't necessarily try to sell you anything. They would just confirm what you have chosen on the site is all copacetic, takes effect January 1st, and what you saw on the screen and what you signed up for, not only is your medication covered, but your doctor's in network, and the monthly premium is what it says it is, and it covers the deductible is X, and the max amount of pocket is Y, and all the co-insurances for each thing. I'm going line by line. Primary care, specialist care, urgent care, emergency department. They have emergency room. Never understood why they call it an emergency room. It's not just one fucking room. It's an emergency department, ED, like erectile dysfunction. Outpatient mental health, generic drugs. Okay, that's what you're going to see in a fucking box here. And then you're going to add filters. Now, this is after you've chosen whether or not you're going to use it low usage, mid usage, high usage, whether you use tobacco. Look, none of them fucking choices even matter. I've done this thing for 5 years, and you can't go back and change anything. That's like applying for a fucking loan and try to go back and recalculate based on some sort of fucking income that you don't have. No. Once it's submitted, it's submitted. It's on the fucking system. It's locked. You can resubmit an application, but that's not going to help you, because what it's going to look like is it looks like you're trying to, for a second time, to fudge the numbers and see if you can get more or less as far as a subsidy goes, or a price. So if you have an application, work on that fucking application. If you're just applying for it for the first time, be as honest as you can, within reason, and roll the fucking dice and see what you get. Now, when you get to the page to where you get to make choices or compare plans, if you had a plan last year and you're getting a plan this year, you're going to be fucking shocked. I got to keep doing this to keep the light on me. My premium went up 7 times the amount of what I was paying last year. I'm not going to tell you what I was paying last year, but this is what throws you into an absolute panic, because you either roll into it and keep the same coverage that you had last year, know that it works, Know that the doctors are on there, the medication's on there, you know what the deductible is, you know what the maximum out of pocket is, you know what all the co-insurances are, and you suck it up and you pay the fucker, even though it's 7 times what you would normally have paid last year. It's not going to be the same for everybody. So if you had it last year and you're going to get it this year, even if the Fed changes the policies or extends the old subsidies as a percentage, because all they did, the insurance companies raised their rate and your subsidy is the same as it was, but the distance between the price and your subsidy goes to is paid by you going to the insurance companies. So they're still getting the same money for the Fed. You're just paying them more on top of what they were already getting out of pocket. So this is an insurance thing, and this is a federal government thing. So if you have until December 15th to get coverage on January 1st, if you want to stay in what you have, by default, it automatically enrolls you in the closest thing to what you had last year, because it'll usually say this plan's not available, but we have this. If it's close, read the fucking fine print. And if you have to put it on a credit card, put it on a fucking credit card. Apply for a credit card. Apply right now. See if you can find something with 0 interest for 12 months, 18 months, and pay your premium that way through 2026, and hope that something changes on a federal level to where either your copay or your subsidy goes up and the rate goes down, or there's some other change to where you can transfer to a different plan with the same kind of thing. Now, whatever's in the system now is locked into the end of the year. The federal government can't go in and change all these fucking rates that they've already set up with these insurance companies. And it varies state to state. That's even a more difficult problem, because what I see here in Ohio is not what I would see in Kentucky, or when I used to live in Tennessee, or when I used to live in Alabama, or when I used to live in the southern part of Georgia, or when I used to live in North Florida. Let's talk about North Florida. I lived 1 mile from the state penitentiary in Florida. I lived in a fucking swamp. It was a business venture. 1 mile as the crow flies from where they executed Ted Bundy. I rented a house. I'd never heard of fire ants. I had also never seen alligator fences. It was a very rude awakening. North Florida is like South Georgia, South Alabama. It's the most southern place you can be and still be in the state of Florida. If you know what I'm talking about, say Gainesville, Florida, home of the Gators. Well, they call them the Gators because there's alligators fucking everywhere. Take 301 from Gainesville to Jacksonville. I'm right in the fucking middle there. Got off on a tangent. I was self-employed at the time. Didn't have to worry about this. This wasn't a thing. If you are applying for the first time, go through and try to multiply your premium by 12, add it to the deductible, and then make sure that whatever else there is, primary care, specialist care, urgent care, emergency department care, mental health outpatient, or generic drugs, make sure that your maximum out of pocket is going to be something that you can afford to pay in the event something happens. Because we all know that $1 NSAID or fucking or $1 Tylenol at the emergency department, got $6.75 pill, and then if you get two 500 milligrams, they'll cut it down and they'll only charge you $10. Remember, you're going to foot potentially 50% of that if you don't pay attention to the co-insurance. Make sure that your out-of-pocket maximum is something that you can afford to pay. and make sure that multiplied by 12, that your premium is something that you can put on a fucking credit card. You're like, well, you're paying interest on that. I'm like, I know. But not everybody has fucking cash savings. Not everybody has employer insurance. Not everybody is indigent and qualifies for the state sponsored. And not everybody has just, they can take the risk. Let's say you're 30, and this wouldn't have been an issue if I was 30, 35, 40, 45. You get up in your mid 50s, and things that you took for granted, you no longer take for granted. So this kind of sort of follows up with my colonoscopy endoscopy. Now that has nothing to do with this, and I'll tell you why. Because when I scheduled that was, I'd already met my deductible, and I was still paying my premium, and I scheduled that before the open enrollment period started on November 1st. On November 1st, it's when they roll out all the shit. And in this case, this year, it's shit because of the subsidies that ended at the end of the year. None of this is sequential. If you have any questions, fucking ask. If anybody actually watches this, if anybody has made it to 11:29, give me a thumbs up, please. There's something to be learned here. You can hear from somebody else, or you can hear it from me. I'm not the burning bush, but I've been through this alone for quite a few years. So it couldn't have had anything that my premium didn't have anything to do with, my increase in my premium didn't have anything to do with usage of insurance in calendar year 2025. It just didn't, because none of this price was out before I had the only major thing that I had, which was a colonoscopy. I don't know how much it costs. Endoscopy. I don't know how much it costs, but I'm sure that it's not cheap. You can't go with a zero premium and a $10,000 deductible unless you're pretty sure that you're not going to get fucking sick. If you do have a $0 premium, let's say your subsidies, whatever, so it's $700 a month, and you can find something with a $20 premium, deductible of $8,450, $7,000, whatever, and the max amount of pocket, say it's $10,500. If you have $10,500, or you plan on not needing anything for the next year, then I guess get it, because it could cover something that was catastrophic. I mean, you're going to have to pay that $10,000 at some point. But at least it's not hundreds of thousands of dollars. So would you rather pay $250 a month, or would you rather pay $35 a month? You have to, what's that one thing Sean Connery said in that one movie, Rising Sun, with Wesley Snipes? Sometimes you got to shake the grass to startle the snakes. You have to go through it and make sure that you're looking at your out of pocket, because that's where it'll get you on a month-to-month basis. If you're on medication, you can't go off your medication if you need it to survive, whether it be mentally, physically, whatever. If your insurance, if your insurance does not cover that medication, then you know that regardless of what pharmacy you go to, regardless of what cash discount they give you, regardless of what cards they have available, if your one script is $1,000 a month and you're going to roll the dice with a low deductible, well, you better make sure that that prescription's covered, because if not, you're going to be real fucking shocked when you go to get your refill in January. Put in every fucking prescription that you have, or any drug that you take, whether it be a generic, whether it be brand name, doesn't matter. Put it in there. Make sure that the plan is going to cover it. Make sure that the providers have a little little green X. If you don't care about, if you're, say you don't have a primary person, or you don't, you're open to different people, or I have a relationship with this, I've been seeing the same guy, since I got sober years ago, and I don't plan on changing because they know me. And I would give their names because they've really helped me through the years. Make sure that if you have a doctor that you want to stick with, that you do the search and find that doctor. You find that man. You find that man. Color of his eyes. Color of his hair. He had a prosthetic. How tall was he? Prosthetic limb. What color of his eyes? You find that man. You find that man. How tall was he? He killed my wife. That's Dr. Richard Kimball. Make sure your doctor's in there. Make sure if you see a therapist, or you see, I don't know what else you might see. Let's say you see a specialist on a regular basis. Some people do. And this isn't even including dental. That's a separate deal. Kind of want to piggyback the dental, keep the same dental you had, because major restorations, they make you, if you change a dental plan from last year to something else, then all of it resets. Because the way the dental plans work is that year 1, year 2, year 3, they end up covering more as you stick with them. Don't fucking switch your dental plan if you're going to need a fucking implant, because some of these on year 4 or 5 or something, by the time your tooth is completely fucking, became unrooted, they'll pay X amount of, on something major, which is an implant. I mean, I have no other choice. I either have an extraction and dentures, or I have an implant. And I thank God every day that I have my fucking painful teeth that are sensitive to heat and cold still. And this is all because of the gastric acid that's eroded my teeth. See, this is all 17 minutes. I'm going to upload this, and, that's going to be that. The reason I have problems with my teeth is because of my problem with my stomach acid. It's not tooth decay because of tobacco. It has nothing to do with it. I'm sure it adds to it. It complicates it. But my teeth have eroded because of gastric acid. Keep that in mind. It's not always because you have, tooth decay and you're not taking care of your teeth and whatever. It took an oral surgeon telling me that shit fucking years ago. They're like, nah, this isn't normal tooth decay. This is acid. Acid in your stomach that's come up into your mouth, and overnight, during the day, whatever. That's why I salivate so much. I hope you've learned something from this, because you've got to protect yourself. I mean, you got to check yourself before you wreck yourself. Maybe something will happen on a federal level and some of this will change, but at least get into it. Stick with what you had last year. Sign up for something that's manageable this year that you can afford in the event of an emergency. And I just got the warning, storage low, tap to manage. I'm going to post this shit. Thank you. God bless you. Take care.